I am Dan Schulte, a partner with Kerr, Russell & Weber in Detroit, legal counsel to the Michigan Dental Association, and today we're going to be talking about a question regarding referral fees. Here's the question. I need to step up the marketing of my practice due to the economic climate. I currently run an advertisement in the phone book Yellow Pages and occasionally in a local newspaper. I'm convinced adding a referral incentive program is the only way I will be able to garner new patients. I would like to give my patients a coupon for every new patient they refer who books an appointment and keeps it. The new patient would receive a set of movie tickets, and the coupon I give my established patient would go into a drawing for a large screen TV. Is this legal? If no, what ideas are legal that I could use to market my practice? The type of marketing you describe is becoming more common all the time. It might seem like a harmless and clever way to attract new patients. However, there is an ethical rule, federal and state law, and possibly contractual limitations that may prohibit the activity you are describing. Let's start with MDA's ethical rule 4E, applying to MDA members, which states that dentists shall not accept or tender rebates or split fees. Notice that the rule is not limited to dentists rebating or splitting fees with other dentists. Rebating or splitting a fee with anyone, including a patient or another non-dentist referral source, violates the rule. A rebate is defined as a return of an amount paid. With the giving to a patient of movie tickets as opposed to a cash refund be considered a rebate and therefore violate the ethical rule. The coupon given to the existing patient who made the referral is less clear, since only the patient whose coupon is drawn in the raffle has received anything of value in return for the referral. These are close calls, and if a complaint was made, the issues would be decided by the MDA peer review ethics system, and the MDA member involved would have to follow its decision. Let's now look at the law applicable to all Michigan dentists, whether an MDA member or not, on this subject. I'm going to assume that these incentives are not being used to attract Medicaid or Medicare patients. If they are, you should know that there are federal laws making these incentives illegal. For now, let's assume that Michigan law applies. MCL 333.16221 states that it is an unethical business practice for any healthcare professional to divide fees for the referral of patients. Would the giving of a new patient movie tickets be deemed dividing a fee? I would say likely not, since the statute seems to be aimed at dividing the fee with the referral source, not the new patient. What about the coupons given to the referring patients? The only coupon to worry about is the one that wins the raffle. Only the referring patient with this coupon has received anything of value. Would the payment of the TV be deemed a division of the fees from the new patients? There is no precedent or other clear answer to this question. Upon a complaint, the Board of Dentistry would ultimately make the call. Finally, you need to carefully check your agreements with insurers and dental plans. Oftentimes, these contracts require you to charge the fee schedule amount to all patients and make reasonable attempts to collect copays and deductibles. Delta Dental's Uniform Requirements of Participation contain these provisions. Will giving a new patient with such insurance or enrolled in such a dental plan movie tickets be deemed by the insurer or dental plan to be a backdoor way of reducing the fee you are contractually required to charge? Is there a prohibition in any insurer or dental plan contract prohibiting the payment of referral fees? Insurers and dental plans often include these provisions as well, so that patients choosing dentists within the network do so based only on the quality of care. Would the coupons and the TV be deemed by an insurer or dental plan to be the payment of a referral fee? This is up to the insurer or dental plan, and if you wish to remain in its network, you must abide by its interpretation. As you can see, no unqualified answer can be given to your question. The best practice is to compete for new patients based on the quality of the care you provide, the hours you are open, and other patient convenience factors. Offering discounts to new patients for the initial treatment they are seeking is not illegal. Use the opportunity to provide the initial treatment to show new patients why they should not go anywhere else for their dental care. But you still need to check your insurer and dental plan contracts to make sure the offering of the discount is not a breach of the agreement. As always, consulting with an attorney to review these contracts is a good idea.